It's a feeling of helplessness Cherise Basque can't shake. Bleeding out in a hospital surrounded by healthcare professionals she says wouldn't intervene.
It felt like a nightmare because it felt like you're in a crowded room with all these professionals crying, begging for help, and nobody's helping you.
When the single mother of 5 found out she was pregnant with her 6th child, she was told by her family provider it wouldn't be safe to carry to term. Basque was provided with medication abortion, a total of 5 pills that she would be able to take at home. But when she began bleeding excessively, she went to the emergency department at St. Martha's Hospital in Antigonish, Nova Scotia. Basque was bleeding through her pants and onto the ER floor, but when she told a nurse why, she says the tone changed.
All she heard was abortion pill, and after that she rolled her eyes at me and she started treating me differently. And then so she was like, no, well, you know what, it's just a pill doing its job. She was like, all this trouble, all this pain, and you can't even bring home a precious little baby.
Basque says she went home only to faint on her front step. She was taken back to St. Martha's in an ambulance, where she eventually was sent in for emergency surgery. A piece of fetal tissue was stuck in her uterus, and she says she was told if she hadn't called 911, she could have died. Martha Painter is a nurse practitioner who has worked to advance abortion access for more than 20 years. She has no connection to Basque's case or St. Martha's Hospital, but says ER personnel need more education around self-administered medication abortion.
We're seeing improvements in that, but that's an area that needs further development to be able to recognize the difference between what is normal, what's okay, versus what needs intervention, immediate intervention.
She says medication abortion is safe and heavy bleeding is typically normal. But if a patient is saturating more than 2 pads an hour for more than 2 hours, emergency care is required. She says she's also not surprised St. Martha's is under scrutiny for abortion stigma due to its religious affiliation. The hospital is known for its mission assurance agreement with Nova Scotia Health, the Department of Health and Wellness, and the Sisters of St. Martha, established in 1996, which outlines and protects the philosophy, mission, and values of the Catholic doctrine. It is the only publicly funded hospital in the province to have this agreement.
In this day and age, having such an agreement is incredibly outdated and causes real harm.
According to the Health Authority in Nova Scotia, which speaks on behalf of all hospitals in the province, regardless of religious ties, all NSH physicians and staff are required to provide a safe, competent, ethical, and compassionate response when interacting with Nova Scotians who are requesting information about or have had an abortion, including clinicians at St. Martha's, who are expected to operate within their scope of practice. Basque alleges her race also contributed to the stigma she experienced in Antigonish.
When I was in the hospital and they refused me, I was staring at my skin just looking at it because I felt different, because they're treating me different. And I don't want my kids to grow up in that kind of environment.
Nova Scotia Health says it is very sorry to hear about Basque's experience. And while it cannot comment on individual cases, adds, we want to emphasize that patient care and safety are our top priorities, regardless of a patient's ethnicity, background, or personal health history.
You know, we all bleed red at the end of the day.
Those looking to terminate their pregnancy or for further information on abortion care can self-refer to Nova Scotia's Rose Clinic. Ella MacDonald, Global News, Buckingham, Nova Scotia.